So welcome to Haiti, students. It's so exciting for you to be a part of this voice thread because I think it's going to really give you some insight of what you should be um, thinking about for your educational piece for your health promotion project. As you can see, this is actually in a church, and this is me to the right with my hand across the little old lady. We refer to her as Gran, which means grandmother. And one of our students is actually right here, Joanne. Um, she's such a cutie pie. She's our pre-licensure student. She just graduated. And so anyway, she is taking notes and assessing with our translator to the right. And then we have another student there that's holding a little baby. And so Gran brought her great-grandchild in to be seen, and of course she needs to be seen herself. This is actually day one of our clinic. I believe that day we may have seen about 425 people, and these are the people lined up waiting to be seen by us. It's very organized, and everyone gets a ticket, and they come in when their number is drawn. It can be a little hectic at times, but as you can see, most people in the morning are the elderly because they're up early, and then in the afternoon, it's usually the young teens that we see. This is another day where we actually had clinic outside. As you can see, we're under the trees. We go wherever. We moved our chairs from the sun, came over to where we were so it wasn't so hot. But we started out under the tree, and it was nice and cool actually that day for it being 94 degrees outside. But as you can see, we have we have three actually clinic setups there, each with a translator. So one might say, how does information get out into the public if there's not enough doctors or nurses to educate in communities? This is actually in the Domon community where I actually have a mission house and where the church was, where we were actually doing clinic. And that truck in front of you actually has a big poster that actually talks about how to take care of yourself by getting your blood pressure checked, what foods to eat. Also talking about just your back to basics, washing your hands. There is Mark Coughlin, Coughlin. Actually, you may want to Google him. He actually works in Haiti. He's a friend of mine that is from Georgia, and he's a musician and artist. And he actually did a jingle with Zami La Santé, which is Partners in Health, and they actually did a jingle on washing your hands, lave dame la santé, which means, good health for those that wash their hands, and that's how they educated. But they're actually now taking that and they're going, which is kind of cool, up and down the roads, playing that music and in their Creole language and getting and promoting good health in communities. So here is a small child where the mother brought her in to see us, and we were so taken back by what we saw. And it's not uncommon that we do see this, and it's where the mother didn't receive the education of what to do with the PO antibiotic. She didn't know that the child needed to take it. That she thought, well, the child's ear hurts, so let me crush it and let me put it on the ear. Excuse me. And so that's what she did. And as you can see, there's pus, there's drainage, and the antibiotic over a certain amount of time has actually eaten a piece of the ear right here. So once again, here's a little old lady that came in, and she's got a terrible wound in her leg. Is killing her. This is why this educational piece, whoever has that piece, it's so important. She came in, as you can see, she's got the tight skin right here, and so she's got high blood pressure, and she has this wonderful wound. And this wonderful wound actually now has caused havoc because she has taken Tylenol or something and put inside of a wound because it was hurting her. So we just really need to educate on that certain medications you take by mouth and you don't put on the painful area. Once again, a severe ear infection, just lack of knowledge. Look at the poor child's ear. It's just draining and oozing with pus. I don't know if the mom had put antibiotic in her ear there as well, but she didn't have the affordability of taking the child to the doctor. And then, of course, she knew about us coming, and so she decided to bring the child to us, and we treated with antibiotics, and then we told her within 2 weeks to follow up at a hospital to make sure that the child didn't need more antibiotic. But of course, we talked and educated on oral antibiotic and not to put anything in the ear. Almost everyone that comes into clinic has some type of blood pressure issues. The normal blood pressure for a Haitian is systolic 140s, 150s. This is something that they walk around with all the time. But they can change their diet, and alcohol seems to be, for those that do drink, just because they don't think of it as a disease. And most of them do drink alcohol. Not that they're able to afford it, but people that can will give it to them to drink. You see small kids drinking alcohol, it's acceptable. That's just the way it is. But a lot of people cook with oil, especially their rice has vegetable oil in it. They cook with bouillon. They don't use a lot of salt. Sometimes we do 3/4. Um, but blood pressure tends to be very, very, very high. A lot of times we'll see them coming in with headaches um, and feeling like their heart is about ready to pop out of their chest. Well, their blood pressure is like 240 over 150. Of course, it's that way. So we give them some medication and an aspirin, and we sit them, we recheck them. About an hour or so later, we want to make sure that their headache's gone away and that when they leave us, they're stable. So that's why the blood pressure education piece is significant. This is Little Gran waiting to be seen, an outdoor clinic, and this is so precious. This little lady also had a severe arthritis in her knees, and her knees were hurting, and her back from heavy lifting throughout her entire life. So, proper body mechanics, we try to teach when we're there, and we show them when we do return demonstration. And but it's just nice to also educate on the proper mechanics, especially to our older generation who works so hard in the agriculture, and everything they do over in Haiti is hard, hard labor. So that's why this piece is so important. We see fungus all the time, especially in little boys' heads. Why? Because they use the same clippers. They'll just take the whole family and go to the barber shop, and I'm not quite certain if sterility is something that they even know about. I think they may wash it down a little bit, but I don't think that they clean after every haircut. And that's why these little boys have this fungus in their head. So as you can see it is right here, and it's also right here, and it's also right here. So it's and also right here. And it can spread. They take and they scratch their head, and then they scratch their face, and then they touch something. And that's why hand washing is also so important. So here is an adult with fungus, and they have it on the neck. So apparently they have been touching someone, scratching their neck, and as you can see, it is all over. It is all over their body. You can see all that white. And so the only way to get rid of that is like athlete's foot fungal cream, and we bring tubes and tubes of it. And so a lot of times we have to treat the whole family because the whole family has it, especially if they're all sleeping together. So it's why contagious. We need a material piece on that so that we can educate to the children and also to the parents or their caregivers. Lastly, this is one of our nursing students in the purple, and actually our alum, Monica, that graduated a year ago, December, from here, and took them on a trip with me January a year ago. And this girl is a young teenage who is pregnant. She's crying. It just really broke my heart. She didn't know what to do next, and she also had an STI. And so, as you can see, Monica is really just using that compassion and just consoling while Debbie's trying to come up with a solution on how to help her and console her as well. It just is, it's just something. But this slide just really shows you that wherever we go, the Bonds core values, mission and values is threaded throughout the world because many of our students go on mission trips around the world and right here locally and right here throughout. So just thought that was kind of cool just to share just something other than an illness per se. She now is, she's just stressed and don't know what to do or who to turn to, and is really just looking for that comfort. So we were able to give her that and just really encouraged her. So anyway, we had our nursing hats on and just gave her the love that she needed for that day.